we are going to discuss a very important group of the diseases that are vector-borne infections. Now, vector means these are different type of insects which can take an infection from one person and can drop into another by bite. Now, we are having very important national program for control of these vector-borne diseases. This is National Vector-Borne Disease Control Program. Now, question is, what important diseases are included under this national program? The important diseases are malaria, filariasis, leishmaniasis, Japanese encephalitis, dengue and chikungunya. These are the 6 important diseases which are being covered under this national program. Now, question can come in your mind that yellow fever, which is also a vector-borne disease caused by which mosquito? Aedes mosquito. But we are not including under this program. Why? And this is the question what has been asked repeatedly in the examination. Now, remember, we are not having the yellow fever in India at all. And our main focus is that we are trying to prevent the entry of virus in India by making all precautions as checking for quarantine certification, controlling mosquito breeding around airports or seaports, or we are doing regular insecticidal spray. So, we are only dealing with those diseases which are present in India. That's why we are trying to control those diseases. So, we will be discussing the different diseases coming under this national program. The most important disease under the National Vector-Borne Disease Control Program is malaria. Now, we are trying to do elimination of malaria infection from India. Now, what we are supposed to know here that how disease is being transmitted, how we can diagnose particular disease, who are the health workers involved in this active surveillance of the disease, and what are the guidelines for treatment of malaria in India as per the species of malaria. So, as we all know that malaria is caused because of bite of female Anopheles mosquito. And this female Anopheles mosquito, when it is giving the bite to a human being, it is sucking blood, and through the blood of affected person, gametocytes they enter in mosquito. Now, in mosquito there is fertilization, then zygote is formed converting into ookinete, and it is then passing to the proboscis of this mosquito where sporozoites are formed. This developmental process is where the organism, it is increasing in number as well as maturation happens. It is the cyclopropagative cycle. We had already discussed this point. So, this is cyclopropagative cycle, and then when this mosquito gives bite to another healthy person, these sporozoites they enter into the body and then they first reach to liver, and where they pass through hepatic cycle or pre-erythrocytic phase and affect the hepatocytes, leading to liberation of merozoites. And then these merozoites they attack on RBCs, and this is the erythrocytic phase starts, and where they are undergoing through the trophozoites, schizoid, and ultimately rupture as merozoites, and then the rupture of this RBC then suddenly causing the spike of fever which is commonly seen in malaria. And some of these trophozoites they can convert into gametes, and when the mosquito sucks the blood, then these gametes they enter into mosquito, and in this way this cycle goes on. So, we have to control the malaria, or we have to prevent the malaria if we can break this step, that is the entry of the sporozoites into the hepatic cells, and this is what our malaria vaccine is doing. Still, this malaria vaccine is under phase 3 trial in the different areas, high endemic areas. Trial is still going on, and this is doing what? It is preventing the entry of the sporozoites into the liver cells, and once this entry is blocked, then rest of the cycle is already stopped. So, we can avoid malaria. So we are waiting for this phase 3 trial of malaria vaccine to be completed, and then this will be freely launched into market. The few more points what we have to know about malaria, that how we are doing the diagnosis of malaria. Now, most important test for diagnosis of malaria is by peripheral smear examination, and the most important worker for this activity is multi-purpose worker male, and this is very commonly asked question, that which is the main worker for active malaria surveillance, or who is conducting active malaria surveillance is multi-purpose worker male. What we mean by active malaria surveillance, active means the health worker is visiting house to house, any suspicious case of fever, slide is prepared, or even in high endemic areas of malaria, randomly the slide is being prepared for even for healthy individuals also to look for any malaria parasite in chronic phase in circulation, because they might be asymptomatic but they may be transferring infection to others. We are preparing two type of smears, and one is thick and another is thin smear. The purpose of thick smear is to confirm malaria, thin is to know the type of malaria, whether it is due to vivax or falciparum, ovale or malariae. Now, we should be very clear that slides can be prepared in periphery. It can be prepared either at the subcenter if the person is coming with fever, or if a worker is visiting house to house, it can be prepared in village. But slide is not tested there. Remember this point. The slide is being transferred to the PSC, where we are having lab technician, and the slides are examined at PSC. Remember this point. So they can be prepared in the periphery, but they are checked at PSC. Now we should be able to get the report within 24 hours. But suppose if PSC is situated quite far away, where we are not able to get the report within 24 hours, in that situation we are going with rapid diagnostic test kits. And what we are checking for, that we are checking for malaria antigen in circulation. So these are a kit, and where we have to simply put the blood, and we can get the line because of antigen antibody complex, and it is already coated with color. So we can get these lines. So these are bivalent kits. We can have both detection of either vivax or falciparum, because in some individuals we can have mixed infection also. So it will give us an idea whether it is no infection, or there is only vivax infection, or it is only falciparum, or it is both vivax and falciparum infection. So RDT kits are used only if we are not having the report coming of peripheral smear within 24 hours, although the best test is peripheral smear examination. We should also know the guidelines given by Government of India as per our national program, that if a person has been confirmed with malaria, what drug has to be given, and the treatment, it is depending upon the species, whether it's vivax or falciparum, as well as it is also depending upon the geographical location of the person, whether that person is living in northeast states or in other states. The reason is that we are having high number of the cases of falciparum in the northeast states, which is causing maximum mortality. So we want to give those drugs only in the northeast states. We don't want to give them in rest of the states to reduce the possibility of development of a resistance. So drug of choices, it is different for the northeast states and the other states. And another important point in the treatment guideline is that we have to take precaution whether the female is pregnant or not, because certain anti-malarial drugs, they are having teratogenic effects if they are being given in first trimester, or they can cause abortions. So if a lady is pregnant, then we have to give the separate set of the drugs. So this we should also know, and we will be discussing in detail. And then we will be discussing that what are the guidelines as per the national program, that for elimination, what different activities we are conducting. So these are the few points what we should know in malaria.